Thanks to a number of factors, breast implant removal is becoming a more common operation within cosmetic plastic surgery. Changing aesthetics, specifically the fact that big breasts and big breast implants aren't quite as big a thing now, no pun intended, as they were in the past. Actually, I totally intended that pun. Women who have had large implants are opting to get those implants either downsized or removed completely. There is the big elephant in the room with this video and breast implant removal is that some women feel that they have an entity referred to as BII, or breast implant illness, and that their implants are making them ill. And this really has gotten a lot of traction on social media, and we'll discuss that here in a minute. There are really three types of implant removal. They kind of fall into three buckets, if you will, and we'll discuss each one. One is what I will refer to as a simple implant removal. Simple implant removals involve simply removing the implant, and then if you have an implant that has been placed underneath the pectoralis muscle, the chest muscle, which is where the under the muscle implants are placed, that muscle is repaired when the implant is removed to put it back where it's supposed to go. What happens when the implant is removed, and this may be a little too much information for some of you, that muscle is lifted up off of the chest wall from where it normally lives and allowed to retract over, come up and ride up over the top part of that implant. And so when we remove that implant, certainly when I remove implants, I will free that muscle up and then reattach it to typically your ribs where it normally is supposed to live. And that reestablishes normal anatomy. You will be sore after that operation because of that muscle attachment. But that's what is involved in a simple breast implant removal. Second type of implant removal is the implant removal with a capsulectomy. This procedure is indicated for women who have pathologic capsules, who have implant capsules that are causing problems. And these can be either partial capsulectomies, so we remove part of the implant capsule along with the implant, or they can be what's referred to as a total capsulectomy, where all of the implant capsule is removed. In women who are having difficulty and have thick pathologic capsules, we try and remove all of the capsule. In women who have had implants under the muscle, this can be a complicated procedure because that capsule is densely stuck to the muscle on top, but then also to the ribs and the muscles in between the ribs, which are right over your lungs. And so trying to remove all of that capsule can be difficult. There are times when there are little pieces of implant capsule that are left behind because it is simply too dangerous or will be too painful, and there will be the potential for causing too many problems if some of that capsule is removed. Now, those are very rare instances. Most of the time, we're able to get all the capsule out, but sometimes it just simply can't happen safely. There is a kind of move afoot on social media to advocate for what's called an en bloc capsulectomy, which is where the implant and the implant capsule are removed together without violating the implant. And typically that includes removing a little bit of the surrounding tissue. Everybody who's watching this should know an en bloc capsulectomy is an operation for cancer. It is an operation if you've been diagnosed with breast implant-associated ALCL, which is very, very rare, and is something that can have significant complications, including puncturing lungs, tearing up your ribs, or partially destroying your chest muscle. And so is not an operation that needs to be undertaken lightly. A recent study in our aesthetic journal looked at women with breast implant illness because most patients who are complaining of this entity known as breast implant illness have found on social media that they need an en bloc capsulectomy, in air quotes, to make themselves better. And what we have found as a group of plastic surgeons, I was not involved in this study, is that it doesn't matter what type of capsulectomy is performed. Patients who are complaining of general, what we refer to as constitutional symptoms, body aches, fatigue, things like that, that are associating these symptoms with their implants, their symptoms either resolve or don't resolve at the same rate no matter what type of implant removal procedure they've had. And so to do a very aggressive implant removal and capsulectomy, running the significant risk for complications when there's no defined benefit, just doesn't really make a whole lot of sense. And that's something that I want to make sure that everybody who's watching this understands, is that unless you have cancer, an en bloc capsulectomy is not going to be beneficial and could cause significant harm. Now, there is some discussion of whether retained fragments of capsule can cause problems. That has also been looked at and doesn't exist. The implant capsules have been studied extensively, and there are also rumors out there that there are heavy metals or toxins or this, that, and the other thing which are present in the capsule, and it's not true. Contaminants in implant capsules simply doesn't exist, and this has been looked at extensively. The third type of implant removal we need to discuss is implant removal with a mastopexy or breast lift. This is really my preferred approach, primarily because not only are we able to get the implant out, but we're able to optimize the aesthetics and the look of the breast after surgery. Oftentimes, women who have had implants removed and have not had any other procedure will look deflated and have a significant decrease in the volume of the breast from the pressure of that implant on the surrounding tissue. So with a mastopexy combined with an implant removal, we're really able to optimize the look, the shape, and the volume of the breast to the degree that we can after removing that implant. So to review, we've got 3 different types of breast implant removal. There's the simple implant removal, there's implant removal with capsulectomy, and then there's implant removal with mastopexy. Thanks for watching this video. If you are looking for more great content like this, please click on the link up here to subscribe for all of our weekly video. We're always looking for topic suggestions, so if you have something you'd like me to discuss, please leave a comment below or shoot us an email, info@drjasonhall.com. Thanks, and we'll see you again soon.